According to the American Lung Association, every year in the United States, almost 400,000 people die from tobacco-caused deaths, making it the leading cause of preventable deaths. Quitting smoking has immediate as well as long-term benefits, reducing risks for diseases and improving health in general. Dr. Eric Presser at Desert Regional Medical Center in Palm Springs discusses the importance of quitting smoking.
There's a direct correlation between lung cancer and smoking. It is true that 10 to 15% of patients that get lung cancer are never smokers, and obviously genetics plays a big part. But your genes have to be prone to getting a cancer. And what smoking does is it revs up the process. So by quitting smoking, you are reducing the fact or the chances that you will get lung cancer in the future. Lung cancer screening is such an important aspect of our life. I've been lecturing for years now that it's going to be as commonplace as a mammogram or a colonoscopy. And the United States Preventative Task Force just recently endorsed lung cancer screening for patients who are heavy smokers between the ages of 55 and 74 by getting a non-contrast screening CAT scan of the chest. The reason is because only 15% of lung cancers are diagnosed in early stages, stages where we can resect for cure. The other 85% are diagnosed in the later stages. That's because our body is so resilient that by the time you actually have symptoms, shortness of breath, coughing up blood, you're already too far gone and your treatment options are limited. Smokers live 14 years less than non-smokers, and 1 in 6 smokers will get lung cancer. So when you look at these statistics, there's no doubt that people who smoke want to quit. The fact of the matter is that only about 5% are successful from abstaining 1 year later. Now those statistics can be as high as 30% if done correctly. The problem is nicotine. Nicotine is addictive. Nicotine causes changes in the neurological system, so you crave nicotine. There are medications out there that can help, but more importantly, there are behavioral therapies, whether it's one-on-one with a clinician, whether it's group therapy, whether it's text messages that are sent to you every day to help you. But the most important thing is that you have to want to quit. Pick a quit date, stick to it. Hopefully you have a good support system. Obviously, it's harder to quit if the people you live with are smoking. Every patient that I operate on, I have them stop smoking at least 2 weeks before the operation. Studies show that even in those 2 weeks, the chances of a post-operative pneumonia are dramatically decreased. The patients all tell me the same thing. They feel better, and they do. And I can honestly look you in the eye and tell you that I have never taken a lung cancer out of someone for cure and they've gone back to smoking. It's a rude awakening, if you will. What I tell my patients is if the electric cigarettes don't work, the hypnotherapy doesn't work, the other medications don't work, I tell them to get a bag of lollipops and I tell them to put a picture of a loved one in their wallet. And every time they go out to have a cigarette, I tell them to pull out a lollipop and look at that picture. Because life is way too short, and all smoking does is cut down on your life.